All right, today we're diving into a story about Ochsner LSU Health Shreveport. Now, this is a major academic medical center, a place people are supposed to trust with their lives. But when you look at public sources, everything from patient reviews to official reports, you see two completely different, totally conflicting stories. So in this explainer, we're going to break down that disconnect and really get into what these sources are telling us about the patient experience.
And it all kind of starts with this one number, 3.0. That's the hospital's average rating on Google for more than 600 reviews. For a huge healthcare institution like this, a number that low, well, it definitely makes you stop and think. It's really the core of the puzzle we're going to try and piece together today.
So on one side, you have the picture the hospital paints of itself, an academic medical center with comprehensive care, all about patient-focused healthcare. But then you have the portrait painted by the patients themselves. And the words they use over and over again are things like worst hospital ever, negligence, and even cover-up. To understand how you can have two realities that are so far apart, we've got to start peeling back the layers.
Okay, let's dive right in. The very first layer, and honestly the most common thing you hear about, is just waiting. Seriously, you read review after review, especially about the emergency room, and the one theme that comes up constantly is these absolutely extreme wait times.
I mean, just take a look at this account. This person says they waited for more than a full day, 25 hours, just to get a bed. And the way they describe it, this isn't just some minor inconvenience. It's a total ordeal. And believe me, this is not a one-off story. You see accounts like this again and again.
And right here, this is where you really see the human cost. An 87-year-old mother, in pain, waiting for 28 hours. But what's also really telling in this review is that second piece, no updates at any time. It's this complete lack of communication that just leaves families feeling totally helpless and, well, ignored.
This final example, this is where that frustration really boils over into genuine fear. A 29-hour wait where the person writing the review alleges that someone else was having a stroke and couldn't get care. So in these stories, the long waits aren't just frustrating. Patients see them as downright dangerous.
But it's not just the waiting, When you dig in, you find this whole pattern of other frustrations. People consistently bring up staff they describe as rude and unprofessional, that same poor communication with families, really confusing billing, and a lot of complaints about the hospital just not being clean.
And from here, the story just gets more and more serious. As we go deeper into the public record, the tone of the complaints shifts. It's no longer just about frustration with bad service. It's about fear. Fear over something much more serious. Direct allegations of medical negligence. So what are people actually accusing the hospital of? Well, when you look at all these accounts, the allegations seem to fall into a few big buckets. Claims of misdiagnosis that led to really severe consequences, descriptions of unsanitary and unsafe conditions, stories of staff just failing to provide necessary care, and even reports of people being sent home when they were still critically sick. And this is where it all becomes very real. Get this. One patient claims they were told loud and proud that there was nothing wrong with your gallbladder and they were sent home. 2 weeks later, they were in a different ER finding out their gallbladder was severely infected and it was spreading to their liver. To quote them directly, "I could have died." And if you thought that was bad, the allegations about unsafe and unsanitary conditions are just, wow, they're shocking. In one review, a patient describes finding used needles just left out on a table. In another completely separate account, someone claims a urine container was knocked over into their family member's food and that the staff served it to him anyway.
Now this brings us to what is, without a doubt, the most disturbing layer of this whole story. We're moving beyond online reviews now and into serious claims that are documented in official inspection reports and public petitions. And here the allegations shift from negligence to claims of outright abuse and a total failure of oversight.
So this isn't just an angry patient on Google. According to hospitalinspections.org, an official state inspection found that the hospital failed to follow the law. It didn't report an allegation of patient abuse to the state's Department of Health within the 24-hour window it's required to. This finding from an official source really shows that these concerns go way beyond just anecdotal reviews.
And then you have a Change.org petition from a group called the Louisiana Citizens for Healthcare Reform. And the claims listed there, they're just horrific. The petition alleges that a patient died after gauze was stuffed in his mouth, that a surgeon operated while high, that a psychiatric patient got cigarette burns from a nurse, and that widespread drug abuse by staff was actively covered up.
The people who organized the petition frame the whole problem with this one stark sentence. Local media ignores it, LSU covers it up. And that feeling that their voices are just not being heard and that there is zero accountability, that's the final and maybe the most important piece of this patient experience puzzle.
So that leads to the next logical question. What happens when these patients and their families actually try to get answers? Well, according to these sources, the final chapter of their story is almost always about the massive challenge of just trying to get someone to hold the hospital accountable. Just listen to this. It's from a transcript of a citizen trying to file a police report against the hospital. They describe getting the runaround for years from state police, the sheriff, the city police, all while trying to report being abused, including being choked while in restraints. It's just a really vivid picture of the bureaucratic brick wall that patients say they run into. And this slide, wow, this just says it all, doesn't it? It gets right to the heart of the frustration. On one side, you have a patient pouring out this detailed, emotional, traumatic story. And on the other side, the hospital's public response is this generic copy and paste message. You can see why patients would feel like that's not a conversation. It's a complete dismissal.
So you end up in this frustrating hamster wheel that patients call the grievance loop, right? Step 1, you have a horrible experience. Step 2, you post about it online. Step 3, you get that generic reply telling you to send an email. And then step 4, according to patients, your formal complaint just vanishes into a black hole with no follow-up. It's a cycle that just leaves them feeling completely powerless.
And all of this leaves us with one last, really crucial question. When you have this huge number of patient stories, and you back that up with formal petitions, and even official state inspection reports that all point to very serious problems, whose job is it to step in, to investigate, to separate what's an allegation from what's a fact, and ultimately to find the truth?